We break the process of swallowing up into 4 stages: the oral preparatory stage, the oral stage, the pharyngeal stage, and the esophageal stage. The oral preparatory stage is preparing the food bolus to be swallowed. So we have mastication, our fancy word for chewing. We have mastication taking place, and we keep the food bolus in the oral cavity for doing that. So, for example, after food enters the mouth, we close the lips off and want to keep the lips closed, keep the food in the mouth. That would involve action of the orbicularis oris and the mentalis. We also don't want the food to drop down the back of the throat, so the posterior tongue body is raised by the styloglossus and the palatoglossus. The velum is pulled down as well to make a barrier between the posterior tongue body, the tongue dorsum, and the velum to keep that food in the oral cavity. That also leaves the nasopharynx open so that breathing can take place through the nose during this part of the swallow. In addition to holding the food bolus within the oral cavity, the tongue and cheeks maneuver the food between the teeth and out again. The teeth chew. Food is mixed with saliva to turn something that you would eat into something that you probably wouldn't eat if you spit it out of your mouth and looked at it. That we call a bolus. Mastication takes place by moving the jaw with mandibular muscles, so masseter, temporalis, medial pterygoid raise the jaw. Lateral pterygoid is used in kind of a grinding action. The digastric, the geniohyoid, and the platysma muscles would be used to help open the jaw in these cycles for chewing. Cheeks are controlled by the buccinator, which is a primary muscle underneath the cheek, and the risorius, helping to hold the food bolus when it's not between the teeth or move it back in between the teeth for additional chewing. The tongue is used to maneuver the bolus as well, so all of the intrinsic muscles can be used to make a space for the bolus and move it around, push it out in between the teeth, pull it back into the oral cavity. We also have our extrinsic tongue muscles that help maneuver the tongue body, the hyoglossus, genioglossus, and styloglossus that might be needed to support that bolus movement. And don't forget, of course, the mylohyoid muscle that lies underneath the base of the tongue and supports the whole tongue body. The remaining part of the swallow is really the swallowing stages proper, the oral, pharyngeal, and esophageal stages of the swallow. During the oral stage of the swallow, and again our fancy word for swallowing, deglutition, we transfer the bolus from the oral cavity to the pharyngeal cavity. So the oral stage starts, we stop masticating, we stop chewing, the posterior part of the tongue is going to be lowered, the anterior part of the tongue is going to be elevated and pressed against the hard palate, and that progression proceeds from anterior to posterior to move the food bolus backwards. That swallow transitions into the pharyngeal phase as the bolus moves past the faucial pillars, the soft palate, and the posterior tongue base. So image from the text showing stages of the swallow. The oral stage would be in those first 2 components where I've added a little extra red oval on here to highlight the location of the bolus. First in the oral cavity, being scooped by the tongue with the velum down, and then transitioning to posterior tongue body down, anterior tongue body up, and velum raising to allow the bolus to transition into the pharynx. In terms of specific muscular actions, mandible raising I mentioned before. Anterior tongue body is going to be mylohyoid, superior longitudinal muscle, anterior parts of the transverse muscles all help push up on the center part of the front of the tongue. Posterior tongue being depressed by vertical muscles, the hyoglossus and the middle part of the genioglossus, bringing that tongue dorsum region down to make kind of a ramp for the food to slide into the pharyngeal cavity. As that compression of the bolus moves from anterior to posterior, the final stages of that will involve posterior tongue raising with the styloglossus, the palatoglossus, posterior part of the genioglossus. At the very end of the oral stage, these posterior depressors are released and the pharynx is expanded to receive the bolus for the pharyngeal stage. In the pharyngeal stage of the swallow, the soft palate, the velum, gets elevated to close off the nasopharynx and the velopharyngeal port. We certainly wouldn't want any food we're swallowing to head up that way. The vocal folds are going to adduct, the false vocal folds are going to adduct, the epiglottis is going to lower, the larynx is going to be elevated, all to try to move the larynx out of the way of the food bolus as it moves through the pharynx toward the esophagus. The cricopharyngeus muscle, which is part of your inferior pharyngeal constrictor, is going to relax, which opens up the entry to the esophagus, that entry called the upper esophageal sphincter. And then pharyngeal muscles are going to be used to help propel that bolus down in combination with gravity. So in our illustration, pharyngeal stage of the swallow, the bolus in step 3 there in the oropharynx part of the cavity, and then transitioning through the laryngopharynx and heading into the esophagus. So elevation and tensing of the soft palate will be done by levator veli palatini and the musculus uvulae. Vocal fold adduction takes us back to lateral cricoarytenoid, transverse and oblique interarytenoids. Pulling down the epiglottis is done by the aryepiglottic muscle. Elevation of the hyoid laryngeal complex is done by our our suprahyoid muscles, the stylohyoid, the mylohyoid, digastric, the geniohyoid, hyoglossus, the thyrohyoid. And then opening of the upper esophageal sphincter is relaxation of the cricopharyngeus. The stylopharyngeus contracts, which helps elevate and open the pharynx to receive the bolus. And then the pharyngeal muscles are going to constrict in sequence to move the bolus down the pharynx to the upper esophageal sphincter. So the palatopharyngeus muscle and the superior pharyngeal constrictor are going to be the first part of that muscular change. And then the middle and inferior pharyngeal constrictors will help continue that bolus movement. At the end of the pharyngeal stage, we transition to the esophageal stage. The pharynx and the larynx are going to return to their normal resting state, so the soft palate is going to be lowered by gravity in the palatoglossus muscle. The larynx will be abducted by the posterior cricoarytenoid so that respiration can resume. The epiglottis will be raised by the thyroepiglottic muscle. The pharynx will be relaxed and opened again by the stylopharyngeus muscle to undo the action of those constrictors. And then last but not least, the upper esophageal sphincter would be closed by the cricopharyngeus muscle constricting. During the esophageal stage of the swallow, there isn't really much that we've studied or that is under conscious control that is involved. We're on to just reflexes now, where smooth muscles in the esophagus will use peristaltic contraction to move the bolus down through the esophagus and into the stomach through the lower esophageal sphincter.